and welcome to the Medicine Matters Diabetes podcast. I'm Eleanor McDermott. To continue our series marking the 25th anniversary of the Psychosocial Aspects of Diabetes study group, we move on to the psychosocial issues surrounding hypoglycemia. To discuss this, I'm joined by Christel Hendrieckx. Christel is a Senior Research Fellow at the Australian Centre for Behavioural Research in Diabetes at Deakin University in Melbourne. Before we go into too much detail, can you start by giving me a brief overview of the psychological effects of hypoglycemia on people with diabetes?
There are many consequences that people can experience when they are experiencing hypoglycemia, but my research and my clinical experience is mainly related to the worries and the fears that people experience related to hypoglycemia. And it's not only when they experience hypos, but it's also just the idea of I might have a hypo that can already raise fear or anxiety. It's mainly the fear, but it's the fear that how people respond to that fear can be very different. So people develop different coping strategies to reduce their feeling of fear.
How do you distinguish between, say, a healthy concern about hypoglycemia and something that's become excessive?
Yes, that's a good question, because from a clinical perspective, we prefer that people have a certain level of concern, because having, let's say, an appropriate level of concern keeps you attentive and makes that you will pay attention to the early signs of a blood glucose going low, and then taking actions to avoid that your blood glucose keeps dropping and you end up in what we refer to as a severe hypoglycemia. So on one side, that's what we would describe as an appropriate level of concern. But for some people, they develop then what we refer to as fear of hypoglycemia, which is an extreme form of worries or concerns. And it's that higher level of worries that will have an impact on how people can have an impact on the way people manage their diabetes, as well as on their quality of life.
Does it affect family and carers as well as the people with diabetes themselves?
Yes, of course, because they are often a witness, if I can refer to them as a witness, of what is happening in the person with diabetes. And we often hear that it's a partner or even children who recognize their family member having a low blood glucose level earlier than the person with diabetes themselves. And you can imagine that, well, still today, hypoglycemia is still a reality for people living with diabetes and managing their diabetes with insulin. So it's still a reality, which means that if the person with diabetes is not around, for example, your child is at school or your partner or family or relatives are at work, it's always somewhere back in your head that they might have a hypo and not be aware that they are going low. So that's one aspect for the family members, but also you can have people with diabetes who are not so much concerned about going low and not paying attention in time that their blood glucose level might go low. And I have seen in my clinical practice that some people actually rely on their partner to pick up that their blood glucose levels are dropping, which put a lot of responsibility on the family members and, of course, will cause them to be concerned.
So how does this fear of hypoglycemia change people's behaviour, and how does it affect their management of diabetes?
I could say there are two ways or different ways that people cope with the fear. You have people who try to reduce their fear by running their blood glucose levels somewhat higher, somewhat above what is recommended as the target ranges. Because if you have hyperglycemia, of course your risk for having hypos will reduce, because your blood glucose level there is less chances that it's going to drop low. And in some instances, of course, you can understand, because having hypos is a very unpleasant experience. And you can imagine in some circumstances, in some situations, that people prefer to run their blood glucose levels a bit higher than what is recommended by health professionals or by the guidelines. And I can give you one example, driving, for example, and especially I've heard parents saying, well, when I bring my children to school in the car, I really don't want to risk having a hypo, because it's not only about me, but it's also about my children. So that is one way that people cope. And if this is occasionally, that's still not problematic. But if people's level of fear is so high, they might run their blood glucose levels constantly in the higher ranges. And we do know the evidence is very strong. If you have chronic hyperglycemia in the long run, this can lead to chronic complications of diabetes. So that's one way, and it has been observed quite early, when research in fear of hypoglycemia started in the late 80s, that people use that strategy to avoid hypoglycemia. But on the other hand, you have those people who will cope with their risk for hypos, or the fear of hypo, by avoiding certain situations, because they don't want to run their blood glucose levels higher, because some of them really fear the consequences of hyperglycemia. As I just explained, they realize, if I'm chronically running long-term running my blood glucose levels higher, I put myself at risk for chronic complications in the long run. So, but then coping with the risk of hypos or experiencing hypo and the related fear, people might avoid, for example, physical activities, going out on social activities with the family, like, for example, a bike ride, or avoiding being alone, which, as you can imagine, will impact on their freedom, and it might impact on their quality of life.
Are there any particular types of people who are prone to developing an excessive fear of hypoglycemia?
That's an interesting question, but actually, there is not much research to say a lot about it. What we do see, that there are people who, in general, are anxious, are more likely to also experience fear of hypoglycemia. So it falls within that emotional profile of being anxious in more general terms. There is some early research where there is some relationship with some personality traits, like neuroticism, for example. But actually, honestly, there is not that much evidence today that more people are prone. What we do know, but that's then less to do with specific personal characteristics, is that there is an association between experiencing severe hypoglycemia. So people who have experienced personally severe hypos, or having recurrent hypos, so regularly having hypos, or have lost their ability to recognize hypos, these people have higher levels of fear of hypoglycemia.
When somebody has developed a fear of hypoglycemia, what can you do to help them?
Well, there are different ways, and in first instance, what is important to explore with the person with diabetes, how they experience hypo, how often they experience hypos, whether they have an understanding of what might be causing these hypos. Because a big issue, if you have regular hypos, what is really an issue for these people, they lose confidence and they also feel out of control of their diabetes management. You can imagine if you have regular hypos and you don't know why they are happening, what is causing it, it's also hard to imagine what you can do about it. So having that conversation with someone about experiencing hypos, whether they have symptoms or not, if they have symptoms, what kind of symptoms, what in their experience or beliefs might be causing hypos, that's a good starting point, because then you get a better idea of the context in which the person is experiencing hypos and how they respond, what their level of fear is. So you will also ask about how they respond, how they feel about it, whether it's impacting on their work, on quality of life. It's really having a conversation about the topic with a person. That's a first starting point. And that will inform what might be for that person the best way to help them, to support them, and to approach the issue. Because we do know that there are people who can be helped by just having a good look at their diabetes management, looking at the dose of insulin they are taking or the medication that can cause hypos they are taking, whether they have a good understanding of the relationship between insulin, the food they eat, physical activity, because these are three key players in managing your blood glucose levels when you have diabetes. And it's complex. It's not an easy thing to have a good understanding of how all these different factors play together. And for many people, and especially when they have been living with diabetes for a long time, having that conversation and a refresher of how it all comes together is a good starting point. And optimizing their knowledge and the way they are treating their diabetes, paying attention to the early signs of hypos. These are really key factors in the first instance. But of course, if the fear is unrelated to their risk of hypoglycemia, because we do know that some people even fear hypos while they don't experience hypos, and what we would consider they are at low risk, then there is something more going on, and then what we refer to as fear management might be more effective. It's talking to them about, yes, those feelings, their beliefs about what might cause their hypos, or why they feel so at risk for hypos. So that's then more what I could refer to as a more psychological approach, where you could use cognitive behavioral approaches or motivational approaches. So, but these two ways of supporting a person with fear of hypoglycemia should actually go together, because you need to establish from an early start in the way you support a person what is going on. Is it a management issue, or is it the anxiety and the fear that are predominantly causing the problem?
When you spoke about the management issues, that sounded to me at least like something that can be sort of done in routine practice without needing a psychologist. And when it's more of an anxiety issue, it sounded more like you might want to be referring to a psychologist at that point.
Yes.
Would you agree with that?
That's overall how this could work best. Yes, I would like to come back about your earlier question about, are some people more prone to fear of hypoglycemia? And now talking about it, and from my clinical experience, there are people who, because they had a hypo, have been involved in an accident, a car accident, for example, or have injured themselves or sometimes even other people, which is really a very traumatic experience. And people who have been through those experiences, they might have fear of hypoglycemia for the rest of their life if this is not dealt with. And what I've seen in clinical practice is that those people, if that conversation is not happening, they might slip through the cracks because they will not have hypos, because their coping system is running their blood glucose levels higher. So from a clinical perspective, this person will not show up with records of hypoglycemia when you look at their CGM outcomes or their finger pricks, so their blood glucose monitoring, because they will avoid having hypos. And for those people, it's really absolutely beneficial to go and see a mental health professional.
How important do you feel the introduction of continuous glucose monitoring has been for tackling people's fear of hypoglycemia?
Well, the research evidence today goes a bit in two directions. For some people, it's really a very good tool to, first of all, because they have that constant information, it's a tool that helps them recognize when their blood glucose level is going low, and that they can respond timely and have some food to avoid that the blood glucose is dropping lower, which is an appropriate strategy to reduce your number of hypos and reduce your fear. Especially that can be a very helpful tool for parents, because with the CGM, as you probably know, you can remotely monitor what is happening with your child's glucose levels. But on the other hand, we have also seen evidence that for some people it's increasing their fear, because with the self-monitoring of your finger prick blood glucose levels, you only have a measure a couple of times a day, and you don't know what is happening in between these times that you finger prick and have a blood glucose reading. But with the CGM, you have constant information every couple of minutes of what your glucose level is doing. So it's becoming then very visual for that person that they might have a lot of fluctuations, and that might, for some people, increase their fear. So it can go in both directions.
If it's increasing somebody's fear, can you sort of tie that in with psychosocial support?
In first instance, I would say it would be good to have a conversation with a person about how to make sense of the data they are getting from their technology. And because it's a lot of data, and it's very hard for someone who starts using a CGM to draw the big picture out of these data. So that would be the first step. And second, then, if the person has a better understanding of what all these numbers mean, then to talk about what they can do from a management perspective in first instance. And if then the person gets more familiar using the technology and responding in an appropriate way, that might reduce their fear again. If not, then yes, as we discussed earlier, then a more psychological approach is probably the best way forward.
So you alluded to this earlier, and I wanted to talk about people who have an impaired awareness of hypoglycemia. Can behavioural interventions help people as opposed to low glucose alarms?
What behavioural interventions, how they can help is to make people more aware of their symptoms again. So we can train people to pay more attention to some subtle signs that their blood glucose level is going low. Now, there are studies going on, and especially in the UK, especially for people with impaired awareness, and there the way they approach or the content of the intervention is really about motivation and beliefs that people have with regard to their impaired awareness, and their beliefs about whether or not they think they can regain their awareness. So yes, definitely research is going on and interventions are going on based on cognitive behavioral therapies.
So these sort of interventions for impaired hypoglycemia awareness, that would be delivered by specialists rather than in practice?
It's often a collaboration with psychologists and diabetes health professionals, because it's not always necessary that for these interventions to be successful, that they are facilitated by a mental health professional. As research has shown, many of these interventions are actually facilitated by diabetes health professionals. So it depends on the content of the intervention. We can train health professionals we can train them to facilitate these psycho-behavioural interventions.
Final question back on hypoglycemia as a whole. What do you think are the most critical research questions that still need to be answered?
I think the direction that definitely we need to proceed with is these interventions. So, and there are a few that are currently tested and that look very promising, but it's still very early day. And I think we will need to see what the outcomes are, how successful they are. And that's definitely a way to go, because we have been studying fear of hypoglycemia for so many years now, and we still haven't come up with a good solution for many people with diabetes, because these trials, again, it's small groups, it's specific groups that we select to take part in the trials, but we really need interventions that can be made available to many more people. And they are there. The interventions are there, the evidence is there, but at the moment they are not rolled out yet to the majority of people who could benefit from these interventions. So that's definitely what I would say, translating the evidence that we have of interventions that work into clinical practice. I think that would be that's what I would like to see in the coming years.
Thank you to Christel, and thank you for listening to this podcast, produced by Medwire News for Medicine Matters Diabetes. Please subscribe for more, and don't forget to visit diabetes.medicineMatters.com for news, expert opinion and practical advice about caring for people with diabetes.